Mental health is top of mind for many people across the country, and today I'm here with Dr. Jayesh Kamath, the Director of Psychiatry Clinical Trials and Research Programs at UConn Health. Thank you for joining us.
Thank you for having me.
And this is definitely a topic that a lot of people have been shedding light on as recently, its impact on folks. Can you explain what MDD is and maybe how that differs from a regular depressive episode?
Sure. So when, if something bad happens in your life, you're bound to get sad. And, sometimes you just get sad for no reason, thinking about the past. MDD it's quite different in the sense that it's a profound feeling of sadness that just simply doesn't go away. Even if something good happens in your life, like I had a patient who was telling me that she was with her kids and her family on July 4th, and she just didn't get the pleasure. She didn't want to be there. And that's really disturbing for people. They then stop doing things. They don't get the pleasure. They lose interest in doing things that they used to do. It starts disrupting their sleep. They feel tired, they can't concentrate. As you can imagine, all of this is going to affect your life. You're less productive at work, you're not available at home. She was telling me that she was getting mad at her kids for no reason. And she was feeling it afterwards. And that leads to feelings of guilt, feelings of, I'm not a good mom, feelings of failure. And in worst case scenarios, of course, you have thoughts of giving up, thoughts of suicide. So it's quite different. It just simply doesn't go away.
And with regular, I don't know if I should say regular, but regular depressive episodes, that's something that people may be able to work through, but with MDD, it's more difficult.
Yes. I think it's just not under your control.
Okay.
You're absolutely right. I think people can, feel sad, and when they're not in a depressive episode, major depressive episode, they are able to move on and say, you know what, I have kids and I'm going to enjoy my kids and I have a lot to live for.
Yeah.
And that feeling just goes away.
So what treatment options are available?
So we have a number of treatment options that are currently available on the market. There are, we call it 3 major classes of medications, and of course psychotherapy. And there are certain kind of medications that belong to each class. They are called serotonin medications, serotonin norepinephrine medications. These are based on the chemistry that they target in the brain. And of course there is combination of treatments. The problem is let's say about 21 million people in the past year in the United States experienced at least one major depressive episode. And about 1/3 of those patients don't respond to what's available on the market. They've tried all these classes, they have tried combination of classes, they have tried psychotherapy, and it's really difficult for them because they're kind of living their life without that pleasure.
Yeah, and that takes a toll.
Yeah, it takes a toll, yeah.
So what is UConn Health doing to combat this?
So we offer our regular services, but we also have clinical trials. For these 1/3 of patients out of 21 million, as I mentioned, we really need new treatments. We need new novel concepts, and fortunately, we are in an exciting era in psychiatry and with novel medications that hopefully will make a huge difference in the near future. So we have, medications that are much more specific, and there are completely novel mechanisms, novel targets than what's currently available on the market. And that's important because, for example, we have this clinical trial that specifically targets potassium channel on nerve cells. And what that does, it stabilizes your brain from the overactive brain that's related to depression.
Yeah. Okay, so things are looking up as far as those clinical trials.
Yeah, and if you want to call us, or there is a website, it's mddclinicalstudy.com, or you can call our team, my coordinators. They are at 860-679-6739. That's one of the numbers. But you can look up UConn Health Psychiatry Clinical Trials and should be able to find us.
Well, thank you so much for joining us, and I hope that the trials continue to work well so the people who need them can get the help that they need.
Yeah, hopefully it'll make a difference. Thank you for having me.
Thank you.